Thank you so much, Ravi. Really delighted to be able to host the meeting for the West Midlands Health Technologies Cluster. I'd like to introduce the other participants in the meeting. David Kidney, who's the chair of the HTC Health Technologies Cluster, and also Paddy Murphy from the Health Technologies Cluster, who will both be presenting in the second part of the meeting in terms of what Health Technologies Cluster is all about and what that can do for the industry and other stakeholders in the region. So first and foremost, I wanted to talk to you about why Dignio, which is a Norwegian digital healthcare company, chose to come to the UK and chose to settle in the West Midlands and Birmingham most specifically. So the reason why we've decided to choose Birmingham of all the places, Dignio executives did the whole tour of the UK and different science parks and different ecosystems. And they came to Birmingham almost by accident. We were not so terribly visible as an ecosystem of destination for health tech companies at the time in 2017, back some time ago. But on the way out of the UK, Birmingham was on the map, so they thought we'll pop by and have a look what they've got there. And long and short of the story is they liked the ecosystem, they liked the richness of the offers here in terms of networking, support for the product and company and business development. They liked the prospects of where the ecosystem was going at the time, but also the attitudes from the individuals within the ecosystem whom they've encountered, which was a very consultative style, very much asking the companies, what do you need? What can we help you with? Rather than feedback from other more aggressively marketing places was they just told them how wonderful they were. Whereas the Birmingham approach was all about, and the West Midlands approach was all about, what do you need? What are your pains? What can we help you with? So Dignio ended up in Birmingham. We are headquartered within the UK, within the Institute of Translational Medicine, within the Birmingham Health Partners campus. And that gives us the opportunity to interact with a range of stakeholders. Within the West Midlands, we run a project with Dudley CCG, which is looking at category 2 COVID recovering patients. So they are the sort of individuals who require face-to-face assessment and are not unwell enough to be hospitalized. They're well enough to be sent home, but they cannot possibly be sent home without routine follow-up and making sure they're okay. So the previous mode of delivery was a daily phone call from a doctor with the implications of once daily only contact, and you don't know what happens before or after. And also the resource implication of the expense of having to pay for someone's time to make that phone call. That was replaced by our solution where patients come to the face-to-face assessment. They're assessed to be okay to be sent home under monitoring. They download our app on their own device. They get trained there and then. They get given additional medical devices, pulse oximeter and thermometer to take home, which are Bluetooth integrated and very easy to use. They go home. They get monitored twice daily with questionnaire and medical devices. And then, and only then, if anything unusual happens, it gets flagged up to the clinicians. So it's an enormous saving of time in terms of only attending to patients who actually need attention and not having to make a routine daily phone call just to find out someone is absolutely fine. We will be having a robust independent evaluation by the West Midlands AHSN. So again, one of those networking stakeholder organizations within the ecosystem who has been incredibly supportive and beneficial to our existence here. The other type of activity that we're involved with is conversations within the whole 5G domain. West Midlands is obviously a test bed for the 5G technologies, and healthcare and social care has been recognized as one of the major industries that can benefit from 5G technology and the ability to connect multiple data feeds within the Internet of Things solutions, and to look both at the individual level monitoring, but also sensors within the environment, and wider once the person leaves and goes outside of their own home, looking at urban infrastructure, transport solutions, everything designed to make people's quality of life better and to give them more years of high quality and economically active life. So that is very much aligned with what Dignio are trying to achieve, which is to allow people to remain as independent as they can be, to manage themselves as much as they can with the conditions that they may be experiencing in terms of health conditions, and to remain economically active for longer and to be as active as they can be, with themselves controlling and managing what is happening to them in terms of their health, rather than the illnesses dictating what they can and cannot do on any given day. So I thought I'd just go through a quick presentation with you, just to give you an idea of the concept that makes Dignio work the way it does. And we've always started from a very user-centric perspective at both ends. Can I be a presenter, Ravi? Do I just do share screen?
Yep.
Host disabled attendee screen sharing. Alternatively, if you pull my presentation up, okay, and we'll just have to go through the next slide, please, Ravi. It will be like the government press briefings.
Can you do that? Thank you. Apologies
Thank
for that.
you. Oh, no, it might be easier to do it that way. Thank you so much. Fantastic. Yep. So we refer to ourselves as Dignio Connected Care because we look at, within UK, the care is really fragmented. So people encounter some social care provision, some domiciliary care, and some healthcare. And there's a diffusion of responsibilities, there's diffusion of budgets. And what happens then is that an individual ends up having to tell the same story to multiple care providers again and again. So our vision is to provide a shared vision of the patient or client, taking their own measurements with objective vision of what's happening with them, and they can do it in the comfort of their own home as and when it's appropriate and they are able to. So benefits of Dignio Connected Care is safety and quality, increased capacity, reduced risk of infection, which is especially pertinent under the COVID-19 circumstances, and reduced hospitalization. So in the UK, we're deploying both in the community and within care homes. And one of the challenges for care home population is that there's a lot of A&E admissions, which are often inappropriate. And if you could have a mechanism for intervening locally with appropriate support from healthcare providers, a lot of those admissions can be avoided with associated savings in terms of costs for the healthcare providers and social care providers. If we could have the next slide, please, Ravi.
Yep, just changing it now.
Sure, thank you. So our platform for remote care consists of one end is the clinician end, which is a web-based interface. So it can be viewed on any machine that can run a web browser. At the other end, we have the patient user, and in between sits the Dignio solution, which consists of three parts. It's software as medical device. It's cloud-based software service, so there's no need for any physical installation. Then there is Dignio Prevent, which is the big beast, which does all the work. Then there is My Dignio companion app, which is downloadable on patient's own device or client's own device, or it can be used on iPads. Our experience is that for the frail elderly and people who find interacting with technology a bit challenging in terms of usability, we recommend iPads because of the features that they contain in terms of making accessibility easy. And we also run on Android tablets. The information goes between patient and clinician, and there's a wide range of different e-health solutions combined in one comprehensive platform. So we can be utilized for telemedicine. We can be used for remote patient monitoring with the third-party medical devices. We can be used for medication compliance support. In the UK, we can only offer the carousel type solution, which basically allows you to load it up, set up specific times for when the patient should be taking the medication or the client. And if they don't, then the staff monitoring the solution knows that that has not occurred, so they can intervene. There is a strong emphasis on self-reporting. So we have very varied architecture for questionnaires, which can be all populated locally with different types of answers, whether they be multiple choice questions or visual analog scale or anything in between. We have a home lab solution, which allows the patients to take the blood tests at home. So especially within the oncology pathway, this is an incredibly useful tool because it allows patients to take their own blood test at home before the clinic visit for therapy. And if they are unwell enough not to be able to receive the treatment, they won't be going in unnecessarily. And also it allows the clinicians to monitor their progress, and weight loss helps them to guide the patients through managing side effects and anything in between. And it gives the reassurance to the patients with the two-way communication tools. And we're also really high on self-management because we strongly believe that individuals should be empowered to perform their own care to the best of their ability and willingness. So we provide a self-management plan which trips people between 3 different zones subject to their answers on questionnaires and physiological measures. And that comes with very specific tasks that they need to complete subject to how well or unwell they are. Next slide, please, Ravi. So our platform supports 3 basic clinical elements: clinical symptoms, medical measurements, communication. The plan is to avoid admissions, increase self-management, and have a close patient follow-up. If we go to the next slide, please. A virtual clinic is a concept that now people in the UK are talking about a virtual hospital ward. So the concept would be that at one end you have the individuals. We always look at the interaction of physical assets, physical presence of healthcare provision and virtual clinic, because sooner or later, however much is managed via the virtual pathway, there is a contact for physical assessment or follow-up or intervention. So we always look at the close coordination and interaction between 2 types of care provision. So the individuals get an app on their own or provided device, and there's also the physical presence of a hospital or clinic nearby. There's co-location and coordination between the virtual clinic and local healthcare. And in the UK, the monitoring arrangements can be set up in different ways. So sometimes it is the core NHS staff that will provide the monitoring, and sometimes commissioning groups choose to appoint a third-party provider that will do the monitoring for them and then just refer and escalate the cases as needed into the NHS care. And the important properties of virtual clinic are you have one single view of patients, you have automatic triaging of patients based on forms and medical measurements, you have chat, which is one-to-many asynchronous, and video, which is multi-party asynchronous, which permits multidisciplinary consultations. And we also have information page, which is all about educating the patients and giving them access to other sources of support, for example, websites or specific tasks they should be completing to help them to stay well and to learn about what makes them better, what makes them worse. The data on our system is fully visible to each individual, so they can see exactly which measurement they took when. And if they did something, they can put a little tag saying, my blood pressure is up because I was chasing tabby down the garden, rather than my blood pressure is up because something is going on. If we can go to the next slide, please, Ravi. Thank you. So the previous one was the concept of the virtual clinic. This one is the pathway of how a patient would flow through it. So the patient would report symptoms via messages or vital signs indicated there's deterioration. Within the care homes, it's usually the patients get put on the system after soft signs of deterioration are detected by the carers, or the other alternative route is to have all the residents on the system regardless and just see what's changing from day to day. And the nurse would do the first triaging. They normally are within the local healthcare provision. And then they decide what happens next. If it's a serious illness, they'll be hospitalized. That's interaction with the physical healthcare provision. If it's moderate illness, changes to treatment can be suggested remotely. So that still stays within the virtual clinic. If it's mild illness, again, that can remain within the virtual clinic because you just provide additional advice. And if it's reassurance, refer to self-care plans. Sometimes people just need a little bit of anxiety diminishing chat. And the steps taken is the patient is registered in virtual clinic. They download the app on their own device, or they are given the locked in iPad, which we can control remotely, so they can't do anything to it to make it disconnect. They report symptoms through risk-weighted clinician-led form, or it could be the carers. So in care homes, it wouldn't be the residents, it would be the carers filling out the forms. They complete medical measurements with own or provided measurement devices, selected for the disease type, and we had different use cases, and we have the Bluetooth enabled integrated devices, but we also recognize NHS has purchased quite a large stock of various devices in response to COVID. So we also permit manual feed of data. And then the healthcare personnel in virtual clinic will monitor the patients or their clients, and they will intervene if required. Next slide, please, Ravi. I will move quickly through these ones, which is basically what makes us different from other companies you'll see like us in the market. And it's quality and experience. We've been around for quite some time, deploying with Norwegian healthcare system. We are the market leader and standard setter in Norway, and we'd like to achieve the same in Britain. We are user-centric. Our patient users are our best advocates. We had one case where a municipality which combines social care and primary care in Norway. They pulled the solution, and one of the patients campaigned until it was restored because it made so much difference to their ability to function and have a good quality of life that we will live it about it being pulled. There's nothing to install, nothing to remove. It's software service, cloud-based solution, and the clinician interface is run on the web-based browser. And predictable costs. So we are very transparent. Coming from a Norwegian business background, we don't have any hidden clauses or layers of costs that can hit someone afterwards. So we're very transparent about what it takes to set the solution up. Next slide, please, Ravi. And I will just summarize this slide as what makes us different is what we do with the data and what we don't do with the data. So we have very high standards in terms of security of the sensitive medical data that we are handling. But what we don't do is we do not monetize our users' data. So we'll send the data to the clinical data controller, NHS, or any other organization, but we're not going to monetize it for feeding algorithms or selling anonymized data sets to third parties. We just wouldn't do that. We believe that the data belongs to the patients and the care providers, and the purpose of the patients putting their trust in sharing this really sensitive information about themselves and their way of being and their sometimes emotional well-being is to help the clinicians make the right decisions for them, not for a commercial company to be making extra money on the side. Next slide, please, Ravi, which could be the last one. There we go. So this is us. This is the Dignio solution, and I'm happy to take a few questions if there are any on the on why we came to this ecosystem and the support we've received, and anything about our solution, our philosophy of being.
Thank you. I think Paddy had a couple of questions actually raised. One of them was, how do patients do their own blood tests? And who are your clients? Is it CCGs, trusts, or individuals?
So we do not do the customer direct sales. Our customers would normally be, in the UK, it would be CCGs, STPs, or PCNs. Or if there's a sufficiently large consortia of GPs, we would deal with them as well, but also local authorities and providers of NHS care. So for example, we work with Mastercall in Stockport. They are a social enterprise providing out of hours and urgent care to the NHS. And they would be our primary buyers. We like to set up at the highest level of shared care, purely because our philosophy is all about connected care and multiple organizations viewing the same patient data. So we like to set up at the highest level. So CCG is ideal because then you can have multiple care providers coming into it, and STP is even better because then you can bring in other players. One of the local initiatives within West Midlands is Walsall Together, who are absolutely a fantastic framework, and we're in conversation with them because we'd love to be able to run our solution with them, purely because they brought so many local pertinent stakeholders where it's not only health impact, but also the whole social care and also housing and other factors that make people well or unwell and enable them to stay healthy. And it's a very disadvantaged area with the apparent health inequalities. And we'd love to be able to deploy our solution there to demonstrate that the connectivity between different types of care provision and different types of support run via one platform can really have a major impact. So we'll see where that takes us, but we are very West Midlands and Midlands minded. So we'd like to demonstrate something here at large scale.
Thank you. I think, Paddy, you've got your hand raised up. You want to ask a question?
It's just a quick one. What is the barrier to growth, Eva?
It's the sort of still fairly outdated procurement pathways. So what we're finding, there's a risk aversion, there's lack of awareness amongst the buyers about what they should be looking out for. So a lot of places have some legacy experiences from technology before when it didn't work, and they're a bit averse to the conversation. This is all changing. There are new funding ways and funding sources for remote patient care because of the impact of COVID. NHSX and NHS Digital are really pushing standards. So we are not particularly anxious about standards for data security or the standards of the technology or what we do or the business practices, because we know we tick all the boxes. But a lot of suppliers won't. But if as a buyer, you're not aware what questions you should be asking, you will not ask the right questions. You will end up locked into a contract with substandard solution. And by the time you discover there's something better out there on the market, it's too late because you'll be running it for a year or 2 years or whatever. So these are the barriers to us, that there's still some outdated procurement practices. There is still perception of risk. There is still people are looking very short term. And for example, oh, I need to buy in text messaging solutions. So they buy in text messaging solution. Oh, I need to buy video consultations. They buy video consultations. Whereas they can have all this within our one solution, which can be step up, step down, depending on the severity of the illness or the severity of what's going on with a resident in a care home. Step them up, step them down within one supplier, one set of risks, one set of costs. But there's still a lot going on in the background, and it's all changing in the right direction. So I'm really delighted with what NHSX are doing in terms of educating buyers and putting together frameworks which are pertinent to technology supply.
Thank you.
Fantastic. Are there any more questions? Because I think Eva will be moving to a second presentation shortly. No, I don't see any hands raised up. So Eva, I think this nicely brings us to your second update you was going to give.
Yes, my second hat. So my second hat is I'm a board member at Greater Birmingham and Solihull Local Enterprise Partnership. And the whole purpose of the Local Enterprise Partnership is to increase the quality of life and drive economic growth within the area that we cover. And GBSLEP covers 1.3 million residents and multiple areas locally. And I just wanted to talk about the specific support that has been put in place for small companies. And there's a whole selection of types of grants, support, expertise, access under something called Step Forward. So if you go to GBSLEP Growth Hub, that's where you will, as a company, you will receive tons and tons of advice, and you will be qualified and will be given advice as to which grant may be appropriate for you or which support may be appropriate for you. But yesterday on BBC Midlands, there was a company called Icon Events from Cannock, which they were one of the recipients of our Pivot and Prosper grant, which is basically 40,000 match funding, up to 40,000 from company. And some people may be a bit skeptical, it's not a lot of money, but that allowed them to completely shift what they do from the events manufacturing items to support events industry to go over to supporting working from home, for example, which opens a whole new market for them. And all the initiatives within the Step Forward campaign are geared to help businesses to innovate and to think about different ways of surviving and then prospering beyond COVID. Because some of the demands that they would have prospered on previously are non-existent, and we don't know with the lockdowns, etc. We don't know when things will be restored to a new normal and what that new normal may look like. So there's a whole host of grants which are there to support companies, and with the Pivot and Prosper, already nearly £2 million were given away in grants to companies. We've safeguarded nearly 500 jobs and created 150 jobs as the result of just that one pathway within the Step Forward campaign. The phase 2 is ongoing. Phase 2 will be rolled out in due course. We've had 395 inquiries in total from companies within the GBSLEP area, out of which 245 referrals were made by the advisors. And again, the referrals are made after a conversation with the company. So even if they are not appropriate candidate for any of the support pathways, they can still benefit. And interestingly, 1/3 of those inquiries were about digital aspects. So things like digital upskilling, getting the tools to digitize the business, and it's sector non-specific. So we're looking primarily at the key sectors linked to the industrial strategy, but the Growth Hub is open to talk to any small company. And very often it's the expertise and confidence that stops people from innovating to survive and then prosper longer term.